Proper needle handling is the foundation of every successful suture. The three key principles of needle manipulation include proper alignment, controlled rotation, and fine adjustment of the needle's position. The needle is initially aligned by grasping it at the suture end, forming a direct extension of the needle holder. This setup enables an immediate and ergonomic handover to the dominant hand. Once aligned, the needle is clamped into the holder. Equally important is grasping the needle at the tip of the needle holder for improved control and precision. A 90-degree angle between needle and instrument is essential for effective suturing. From the initial forward setting, where the needle acts as an extension of the holder, a simple 180-degree rotation transitions into the backhand position, allowing flexible access to different tissue angles. To reposition a clamped needle for an ideal 90-degree working angle, one method involves grasping the needle at its base. With the needle holder unlocked, the needle can be rotated carefully into position. An alternative technique uses the front third of the curved needle. Again, with the needle holder unlocked, this method allows for finer angle adjustments using a tip-controlled grip. The most demanding method, known as needle handling, or needle dancing, involves guiding the needle by manipulating the suture itself. With the holder unlocked, subtle corrections in needle orientation are possible. This advanced approach also enables complete transitions between forehand and backhand positions, enhancing surgical adaptability without regrasping the needle directly. Ultimately, it is essential to ensure the needle is positioned at a 90-degree angle relative to the needle holder. Practicing these techniques with both hands is strongly recommended to develop ambidextrous proficiency in laparoscopic suturing.